Hey, Empowered Badass Breeders, 2 tips for if you have a mom that has a C-section. So one is, if it's their first time ever having litter, of course it's not ideal that they have a C-section. I've had moms just pick up beautifully and know exactly what to do, and then I've had others that I've really had to help them understand these are your babies and you need to let them nurse and you need to clean them, and there was a lot more work and effort put into it to help them understand. So one thing I do ask my vet, and of course it's up to the vet, but you can ask if it's a first-time mom. I don't have this issue if they've already had a litter. Like, they wake up from the C-section, they know what to do. But if it's a first-time mom, if the vet is willing, if they will keep a placenta, that then you can, or that they will, when as mom's waking up, I know it's kind of gross, but kind of rub that scent on the puppies and or then let her eat the placenta. Just an idea to help kind of kick in those maternal instincts. It may help. So if it does, that's great. And especially if you've had a mom that's had a C-section and rejected the litter and you did breed her again, maybe this would be something you could employ. If at all possible too, I've heard, I haven't done it though, if the vet's able to, before they break open the sac, do it over a jar or a bowl and keep the amniotic fluid and rub that on the puppies when she wakes up, so that she's cleaning off the amniotic fluid from them. The second thing, I have learned this the hard way, is even if it's a seasoned mom, and it's common sense, so I'm really mad at myself that this happened. So if they, they've been under anesthesia, and so even though they come home early and then I let them be with their puppies that night without sleeping next to them or staying up, because I'm like, they're a seasoned mom, we haven't had any problems. And I really feel like it was just because they were still kind of dopey from being put under that they laid on a puppy. So, and then I caught the second one because I learned from my mistake, and I stayed up with the second one, and it almost happened with another mom. So it's just kind of standard protocol that if they've had a C-section, we will stay up with them, especially if the C-section is later, closer to the night, if they still have the anesthesia in their system, because we don't want any issues with them laying on their puppies, because they're just still kind of drugged up, if you know what I mean. So they're just not as aware and may not care as much if a puppy's under them, because they don't feel real great. So those are 2 tips or tricks you can employ if your mom has to have a C-section. Let's talk about calcium today. There is so much misinformation about when we should administer, how much we should administer, why we should administer, and symptoms that we're misreading and then we're giving calcium. I will say, with 13 years breeding and all of our litters that we've had, this has been my protocol. We administer calcium halfway through delivery, approximately halfway through delivery. We buy the calcium supplement. There's a couple. There's like Oral Cal. You can get it at Revival. You can get it on Amazon. It's in a tube, and you slide the little thing based on weight, and it's paste, and we stick it in the back of the cheek halfway through. There's really not a lot of documented evidence that that's even beneficial, but I have done and spoken to several vets that we don't feel that there's any negative benefits to doing that either. So that it's not interrupting the body's natural calcium levels. So why we do it is it helps the uterus potentially contract and gives it strength. So like if a mom starts to stall, a little bit of calcium might help them. I am not a vet. Okay, I know you guys know that, but I just have to say it. Please speak to your veterinarian always first. But I'm just sharing my experience with calcium and why I feel like we're getting it so wrong. You should not be supplementing during pregnancy. You talk to any veterinarian, reproductive specialist, Google it, you should not be supplementing during pregnancy. What happens is when we supplement, then the body stops producing and we throw everything into whack. So as long as your dog is being fed a well-rounded, nutritious food, the body will produce calcium. They do say, though, that there are certain types of foods that are high in phytate, like wheat bran, soybean, rice, can alter the way the body absorbs calcium. So avoid foods that are high in that. But other than that, just nutritious. Do not be supplementing calcium during pregnancy. I know dogs can get preeclampsia, that's low calcium during pregnancy, and can get eclampsia post whelping, that's low calcium after. However, you should get a blood panel done, a CBC, and a total serum calcium count to see if they're actually low. The problem is with us breeders is a lot of the symptoms of eclampsia can also be other things post-whelp. So symptoms like, they also call this milk fever, by the way. If you've ever heard of milk fever, it's eclampsia. Dogs' symptoms of eclampsia are a fever, which is never a good thing. But I find within the first week after a dog delivers, anything under 103 is normal to me. So 102.5, 102.6, 102.7, I don't worry. Once we hit 103, then I'm on high alert. Then I feel like there could be something else wrong. Mastitis, infection, eclampsia, whatever. I personally, knock on wood, in all these years of breeding have not dealt with preeclampsia or eclampsia, thank goodness. I also do not supplement with calcium before or after delivery. We give 1 time of calcium about halfway through delivery. I have found and seen we are supplementing way too much, and we are disturbing the body's natural ability to create and absorb the correct amount of calcium. I will say that toy breeds are more predispositioned to milk fever. So if you do toy breeds, just be more alert. But other symptoms are tremors and shaking, which can also be normal post-delivery. A fever we talked about. Clumsy, stiff gait. They say poor maternal behavior. And this is why then when we have dogs growling at their puppies or trying to bury their puppies or guarding their puppies and trying to bite you, everybody's first comment is give calcium. No, the poor maternal behavior would be a mom that feels crummy from a high fever and isn't cleaning them and is just laying there and is disoriented, clumsy, stiff gait, panting and whining, vomiting and diarrhea. Those are some of the common symptoms. However, those can also be a whelping room that is too warm. You'll get panting, restless, poor maternal behavior if they're just too warm. So I always go in kind of a checklist of, let me figure out what's going on. If the mom is being naughty to her puppies, I correct that behavior. That's an adverse behavior and it needs to be corrected. If they're guarding their puppies, that's also very difficult to deal with if they're trying to bite you. I'll be honest, I don't breed those dogs again. If momhood is so stressful that they don't trust us to potentially save a puppy or help them and be able to mitigate them the way we need to care for them, that's a huge issue for me. So we will not breed again if it's so stressful for a mom. They feel like they have to guard their puppies. But we check the temperature, take the heating pad out, decrease the room. We tend to keep the whelping rooms warm for the puppies, but we have to remember we have to keep the temperature for the moms, and the moms will help regulate the puppy's temperature. So keep your room at 68, your whelping room, so that our moms are not too warm. Of course, if they're long-haired and depending on the breed, and if they're short-snouted, you know, the room needs to be a little bit cooler for them. So don't confuse naughty moms that need a correction and taught and guided what's appropriate and what's not appropriate. The room is too warm, or they're just not a good mom and they shouldn't be bred again. With calcium, please stop thinking calcium is the end-all be-all, the only reason why a mom is struggling post-whelp. again, I am not a vet, but I will say, do your own research. And I'm here to tell you, there is no research founded that calcium changes the behavior of a mom if they're guarding or trying to attack their puppies. Calcium does nothing to do with the behavior and what's going on in their brain. Of course, if they're low in calcium, they're going to have poor maternal behavior, but that's because they feel crummy. So do you see the difference of behavior and then just not feeling good? So don't get those confused. Please stop thinking calcium fixes everything and that we should be supplementing before, during, and after. There's not the data that supports that. In fact, it's the exact opposite. So empowered badass breeders, keep the ice cream to yourself. Keep the Tums to yourself. We need it more than they do. Stop with the calcium. An important message or note, I guess, I want to talk about curriculum is that it's just not willy-nilly. You just don't put a bunch of random items in space for them and leave them in that space for 24/7. I think it's really important to think about and remember when they go home, they're not going to be in a Disneyland environment all the time. There's going to be times where their environment is more sterile, when they're in their kennel, even down in someone's front room or kitchen where everything's picked up so they can't chew on everything. And they have their 1 or 2 toys. You know, I've always said puppies should have 1 hard toy, 1 soft toy, and rotate those each day. And so when we're looking at curriculum, I have found it to be highly beneficial of laying this foundation of you work with and for me. I'm going to put you in an environment. I want you to be brave. I want you to be curious. I want you to practice your startle recovery. I want you to problem solve. You know, we're building this confidence and nerve strength. We want low sight and sound sensitivity. So it's very intentional. So I set up their environment, I put them in, I use the yes and marker word. Yes, you're brave. Yes, you can do it. Yes, you can believe in yourself. And we work through this environment, whatever stimulation environment I give them, thinking about tactile, overhead, problem solving, different shapes, different sounds, different textures, different types of problem solving, and letting them work through that, and then ending it with love and affection. So giving them a puppy massage or 10-step handling, holding them close to your face and heart, and then putting them in like their toddler stall, or if you kennel train, putting them in their kennel, so that they learn to self-soothe, that they learn that not everything is overstimulating. I love to be able to move my puppies to give them adaptability and flexibility, something they will need for the rest of their life to be well adjusted, by moving them through high stimulation environments to then very low stimulation environments, and they can make that switch seamlessly and beautifully because they will need that skill when they go home, without a doubt. Thanks for riding shotgun with me today. Have a great day, you guys. Bye.